Amen. Thank you, ma'am.
All right, thank you so much, Ene Obi, the Country Director of ActionAid Nigeria, for setting the ball rolling. Permit me to introduce the speakers. We have three erudite women who are going to speak to us on this issue. Number one is, permit me to introduce Ebere Ifendu. Ebere Ifendu is the president, Women in Politics Forum. She is also the director of gender. She's the director of the Center for Gender Education and Rights in the University of Oturu, Abia State. Ebere, you are welcome. We are happy and glad that you are joining us.
Thank you very much.
Yeah, the second speaker needs no introduction. The Honorable Minister herself, Dame Pauline Talon. You see the way I paused in reading out her name. Thank you so much, Ma, for joining us. We are very glad you're able to come to this event, even at a short notice. The other speaker we have with us, yes, Ma, thank you, Ma. Yeah. The other speaker we have is Seun Ayodeji. Seun is a young activist. She is the executive director of Stand to End Rape. She will be joining us very shortly. Before we allow the speakers to speak, permit me to also sort of lay down how the agenda will be. First, we will have the three speakers speak to us in 8 minutes. Each of them will have 8 minutes to present to us what they have. And then we'll go into around 15 minutes of conversation, of question and answer, which Vivian will lead us through that process. After the question and answer session, we'll come back for audience interaction. Anybody who wishes to ask any question or make any comment, please just raise your hand and you'll be recognized. We have 25 minutes for that. Ensure that your microphone is muted, that others can hear each other. We can hear. After the interaction, the speakers will also have another round of 2 minutes to be able to round off the conversation. And then we'll have a vote of thanks. So 90 minutes, very straightforward, very engaging session. We are looking forward to it. I will call Ebere Ifendu to start the ball rolling. Ebere, you have 8 minutes.
I can start the ball now.
Thank you.
Yeah, thank you, Nkechi, and thank you, Sister Ene. The Honorable Minister, you have my respect all the time. Thank you very much, ma'am, for coming. It's an opportunity to be on this program with you. We are going to be talking about, for me, I'm going to be talking about women in leadership and what role we can play with the COVID-19 issues. And for me, most times I always talk about not having a huge number of women in politics. And then that translates also to leadership positions in different angles of what we do. We have seen that the COVID-19 PTF committee came up without having our Honorable Minister for Women Affairs as one of the members of the PTF. That was a big blow to us as Nigerian women who will speak for us. And that's where I'm anchoring my thoughts on this issue. Looking at Nigerian women and then the COVID-19 as a pandemic, you will see that women are mostly the caregivers. So we are, out there as the frontline people taking care of COVID-19 issues. And then we are forming a committee where women are not represented. Who will speak for us? Who cares about the 70% of caregivers that are women? Who will put out, questions concerning their welfare, concerning their health issues? We are hearing every day that more caregivers in the hospitals are getting affected, of COVID-19. And then we are not even getting the statistics. These are the statistics. When I say this is based on gender, they are not letting us know how many women that are affected. You will be so shocked to know that if we have about 50 caregivers infected with COVID-19, 40 of them will be women. And yet women are not, at the helm of affairs of taking decisions concerning COVID-19. We also know that in the world global leadership level, we have only 20% about that of women that are in leadership positions. And so you see that discrimination against women comes in different angles. And for me, this is something that we'll have to speak up against. We have women who are doing, who are giving care to sick people. I listened to a man talk about when he was diagnosed of COVID. The man said he called the hospital didn't come, and then the wife continued to take care of him at home. And then I got to a point where he was a little stabilized before the hospital could come for him. And he had a decision to make. Should I go to the hospital and not get care, or stay back at home and get the necessary care? And then he stayed back at home, and his wife saw him through COVID. Today, the man is healed. So this will tell you that even at home, we are caregivers. We take the risk to take care of our children, to take care of all the people within our homes. And then now nobody is looking at our needs as women. They are sharing palliatives. You can hear people talk about rice, Indomie, and the rest. Nobody is talking about the women's sanitary needs. Nobody knows that all the caregivers that are in the hospitals giving support to sick people will have their own personal hygiene needs that they will need. And so palliative will not comprise of sanitary towels. This we have seen coming up anytime they are talking about palliatives, and this is because nobody understands it. And then let me also talk about some countries that really made huge impact and success story out of this COVID-19. These are countries that are governed by women. So we have Germany, we have Taiwan, we have New Zealand, we have Iceland, we have Finland, Norway, and Denmark. And it's recognized all over the world that these countries have done tremendously well in the fight against COVID-19. They have been able to turn things around for their respective countries. And these are countries that are headed by women. So what will Nigeria not benefit? Nigeria will have a lot to benefit if they have women at the helm of affairs taking decisions concerning COVID-19. Nigeria is here to understand that women are a very strong factor in development. We are moving away from the healthcare system now. I'm going to talk about economy. How many women are doing petty trading? These are women that sustain their homes. These are women that are not even recognized. I heard Sister Ene talk about families now beginning to appreciate the role of women in the home. Husbands taking a break to work out to see if they can get fresh air. Yeah, the house is so congested now with children and their needs. But this is something that we have been doing effortlessly. These are things that we have been doing as if, they are not, and they are beginning to understand it now. And so if we even want to start asking for a certain percentage of a man's salary to the woman for keeping the home, I think this is the right time to do that. So I think that we should get involved more. I think that from what the United Nations talked about on, how to make sure that women are represented. We have talked about women being on the front line. We have talked about men not coming up to support women. And UN Women came up with some recommendations, and they talked about having sex disaggregation of data. And that's what I said earlier. When we have people, the number of COVID-19 positive people, let us know the number of women involved, let us know their economic status, let us know everything that is there. When they are talking about people that they have also released from the hospital, the ones that got well, we should also know the number of women. That will also help us. The health workers, we want to have the aggregate of who is doing what. And then we want to see that support given to women are prioritized. And that's where I talked about like our health issues, and Sister Ene talked about the women going to the hospital for antenatal care, and they are not even getting support because most hospitals actually have closed down on having to treat patients. And they are not considering that we have, some of those illnesses that it's really not an illness, situations that we need support. We have to give our children vaccination for, some of the ailments that they are regular vaccinations as children, immunization this time. And then we also have to talk about women that are pregnant that will access healthcare at the antenatal and then postnatal care also. So if hospitals are not receiving people, what will be the fate of these women? It will increase, the death number of women. So child mortality and maternal mortality will be on the increase. We talked about gender-based violence, and it has really gone on the increase. I concentrate more on political leadership for women, but I've received so many calls on gender-based violence at home during this COVID-19. And I'm looking at it as, it's because this is the first time some men are able to sit down with their families, and then they're beginning to, not be able to manage the home very well. And then another thing that is coming up again is sexual violence. Sexual violence, even on the part of married women, because most times people don't understand that a married woman can be raped by her husband. So there's sexual violence even at home going on more this time. And then with other neighbors also being affected. I've had cause to intervene on a case of a young boy who was violated by a neighbor. And I've also had cause to intervene, on a huge violence against a woman in Rivers State. It was so bad that the man brought out machete to kill the woman. So these are the things that we are going through now. But on a good note, I want to say that I also have heard some people talk about using this period, to mend and then, work together as a family. I've heard some people tell me that, that this is really an opportunity for them to understand their spouse. And in a positive way, yes, this has helped. And then I was also reviewing something with my sister the other day, and I'm looking at the post-COVID-19. And I said that we are just talking about COVID-19 as it is. Now, what will happen about the post-COVID-19? Are we also prepared for the population explosion that will come with it? Because most women are going to get pregnant this time. And after COVID, we are going to have a number of newborn babies coming around. Honorable Minister just saved a woman who gave birth to triplets just recently. So these are things that will continue to come up. And then it's an opportunity for us to review and know what we can do as women to support what the government is doing. But for me as a woman, I'm saying that not having women involved in decision-making, not having women speak for women is a huge gap that we are looking for. We are going to suffer under this COVID-19. It's already a pandemic, it's already hitting us hard, and then removing the vital people from decision-making will, cost us more. So I think the government should have a rethink and a review of some of the activities, and let's have more women involved in leadership positions. Thank you.
Thank you much, Barrister Ebere, for always speaking with passion. I could feel, I can hear what you've just said to us. Thank you so much. So thank you so much. I think we'll just to the minister as Ayodeji is still having issues joining us. Let's have the Honorable Minister to talk to us for 8 minutes. Honorable Minister Mara, thank you. You have the floor.
Thank you very much, Nkechi. I want to start by thanking my leader and commending her for speaking so well. When I say my leader, you'll be wondering, Ebere is my leader. She's the president of Women in Politics. So I want to use this opportunity to commend all Nigerian women for their resilience, for their patience, for all that they've been going through since COVID-19 set in some 2 months ago. It's not been an easy period for every family. It's been a very, very difficult and trying moment for all of us. And you'll agree with me that women have been the ones carrying the whole burden, both at the home front and in the field as soldiers out there, as caregivers, majority of the health workers out there offering their services to save lives, risking their own lives. Majority of them are women. And I commend all of them, and I pray that God will continue to protect them. I pray that we will not have any further reports of health workers being infected with COVID-19. Women, as mothers in the home, as caregivers in the home, have been carrying so much. And I want to commend all the NGOs, the international organizations, and ActionAid in particular, for your sentiments, for your love, for your concerns on issues affecting women. It is your voices that is helping the ministry to keep going. You've been a source of strength, and I want to appeal to Nigerian women to continue being true mothers in the home, to continue to exercise more patience in managing the home front. Because as very rightly said, there are so many cases, so many calls. I receive minimum of 50 distress calls every day from women, either sexual violence, domestic violence, all forms, children being abused. It's not just women, our children have been abused, some thrown out in the street late in the hours of the night because of insensitivity and wickedness of man. I want to appeal with a very, very loud voice to our men folk. In every bad situation, we have the good and the bad side of it. The good side, there are so many good and bad sides of COVID-19. To me, the good side of COVID-19, it has helped to bond the family together. So many homes were strangers, so many parents were strangers to their children. So many homes were just everybody who has been on his own. The man leaves home in the morning, he comes back late in the night, the children are asleep. Children are left at the mercy of the nannies and workers at home. But for COVID-19, we are forced to live under the same roof from morning till night. And the bad side of it is so many men are not used to staying 24 hours in the home. And they get stressed up, they get depressed, and they transfer the aggression on the women and the children. I'm appealing that we should use this lockdown and all that the challenges that come with COVID-19, we should use it positively to understand ourselves better as a family, to know our children better, to check on the kind of company they keep, the friends they keep, what they do at home, what they do in school, help check their schoolwork, support them with the online classes that is on now, for those that are privileged to have that. For those in the rural areas who are not opportune, and that's where my heart goes to. I pray that the men will stand in and support these women. Supporting the wife and the children is supporting yourself, because there's no way, if you are, a family is one, and abusing the wife and the children is destroying the family. So I pray that the men will realize that God is speaking to us under COVID-19. COVID-19, to me, I see it as the hand of God. The speed in the world was too much. The speed was too much. We had no time to look back. We had no time to check what is happening at home. We had no time to rest. We had no time to do anything, particularly the children, completely neglected. But now, God said, hey, enough. I pray that we will use this period to reflect, to think, to pray and seek God's face. Because COVID-19 to me is a punishment from God. God is angry with the whole world. And how do we respond to it? COVID-19 has humbled all the leaders of the world. It has humbled everybody. We are all together now in it. Nobody is moving anywhere. If anything happens, we are all going to the same hospital. We are going, we share the same burden now. What we see on the social media is frightening for powerful nations like America, where a senator on the floor of the House is speaking and broke into tears. We have nowhere to turn to but God. I am appealing that women should use this time positively to check and bind the family together. More patience. I am praying for more grace because women are carrying so much burden. And I also want the Nigerian community to realize that reaching out to support the woman is supporting the country, is supporting the family, because whatever a woman gets goes directly to the family. It is the children and the husband that will benefit from it. I'm yet to see any woman that will let her children go hungry or sleep hungry, or her husband to sleep hungry, despite whatever situation she goes through. So we must carry women along. Carrying women along is not a privilege. It's a right that will help move our country forward. I share a lot in your sentiments and I appreciate your concerns, but I thank God that in the midst of whatever has been happening, I want to commend the wife of the president who has reached out to Nigerian women through my ministry to support the indigent women, particularly the widows and the vulnerable. These palliatives were shared directly to them. And another good news is, yesterday, my sister, the Honorable Minister of Humanitarian, also reached out. And we are working on it. We just received the items yesterday. Today, by today and tomorrow, we'll ensure that we come out with a fair distribution network to reach out to those that did not get in the first instance. We have so many women organizations out there. We have so many groups of vulnerable women in need, those who have been living on daily basis, those who sell granite, banana on daily basis to whatever is the process is what they will buy to feed the family. With the lockdown, they are grounded at home. I want to appeal to Nigerians that we should bring back the community spirit. We must be our neighbor's keeper. How on earth will you sleep well when your neighbor is dying of hunger? When the children in that next door to you are crying for food? How on earth will you close your eyes and sleep? I'm appealing to all well-meaning Nigerians. I commend our well-to-do Nigerians, the billionaires, who have reached out to support the federal government. Yes, the procedure of using such proceeds will take some time because COVID-19 comes with a lot of challenges. But when we talk of survival, it is the woman that is the heart of the home. If you talk of surviving the family, it is the woman. If you reach out to women, you are reaching out to the family and the society at large. I appeal to all women leaders, and while we share out these palliatives, I told them that we must have the fear of God in all that we do, because COVID-19, as I earlier mentioned, is the hand of God. And if you take what is meant for this, the poorest of the poor, or the widows who live on daily bread, and now they have nowhere to turn to, if you take what is meant for them and sit on it, you are inviting trouble upon yourself and your family. I thank all those who are reaching out to us and those who are planning to reach out to us. I pray that the Almighty God will touch your hearts so that we will get more support to support these women. The needs of women in the family are so much. Apart from food, I better mention it, the toiletries, the sanitary pads, so many things that a woman needs. The girl child needs such things to keep herself. These are things that she cannot come out to beg on the street. These are salient things, needs of a woman that she feels is very personal, but when we reach out to them, you wipe the tears on their faces. I believe that Nigerians can do better. I believe that the well-meaning Nigerians, those that are blessed, will reach out to us, to reach out to these women. And I have vowed, I've made my stand very, very clear to all my staff. I said, this is a time to make sacrifices. This is a time for us to sacrifice, at least. For those in the offices, at least you are sure of your monthly salary. And I commend Mr. President that so far since he assumes office, he has been doing well to ensure that salaries are paid. So you, at least for the civil servant who is sure of his salary, you are better off than the woman or the widow who has no meal, who has no means of subsistence, who only managed to sell her granules or her vegetables or her tomatoes or something, either to roast the corn in order to sell in to feed her family. So we are appealing that Nigerians should be their neighbors' keepers. We should reach out and support women. You should ensure that we carry women along, because the eyes, the way a woman sees things is different from the way a man sees things. I always say that a woman has her eyes round both the front and the back. Our eyes are all around us, because when a child is naughty, those in front of you, as in those that are being naughty behind, they still see, because it is a special gift. And for that, when women are carried along, we will help improve governance, because we see things differently. We see things as mothers. And that was why God created the woman, to support and complement the effort of the man. If God thought that the man can do it all, he wouldn't have created the woman. So,
Honorable Minister Ma.
Thank you.
Thank you so much. Yeah, thank you so much for what you've spoken to us. I'm sure those who have ears are listening. We would like to call in the next speaker, Oluwaseun Ayodeji Oshowobi, for 8 minutes. Oluwaseun, please keep it. Thank you.
Good afternoon, everyone. Thank you so much for having me. All protocols duly observed. I'd like to talk basically around gender-based violence during the COVID-19 period. And what I have realized is that we do not have a gender approach in terms of response during the COVID-19 period. So for example, we don't have any information from the Ministry of Women Affairs, for example, around what kind of care can women receive at this time? Where are the healthcare facilities that you can visit? Some might be closed down, some might be dedicated to COVID. Which ones are actually dedicated to attending to cases of sexual and gender-based violence? And we know that pandemic creates an opportunity, for people to be in close proximity with their abusers. And majority of these victims are women. And over time, we've seen an increased number of cases, domestic violence cases and sexual violence cases. There was a day we received about 25 reports of domestic violence, and in about a month, we had gotten over 80 cases. There is an increase in violence against women and girls, but there is really no information out there nationally about, if you're in Ondo State, for example, these are the places you can get support. If you are in Anambra State, these are the shelters available in your state. There is a depth of information. There is no national coordination at all on GBV response. And when I say gendered approach, I hear the minister talk about funding from the billionaires and millionaires, which is great. But my question is, in all of this funding, where is the gender approach in it? How much of those funding have actually gone to shelter services for women and girls? How many of those funding has gone to palliatives for women and girls, for example? And when I talk of palliatives, I'm not talking about rice and beans alone. I'm talking about sanitary items. Most women do not have access to sanitary pads, at this time. How many of those have we given out as a ministry in Nigeria? I really haven't seen anything. So people giving money is great, but where is the gender approach in it? And I want to talk about the limitations before I talk about recommendations. We all know that we had restriction on movement. And when this decision happened, my expectation would have been that GBV response would be priority in terms of essential services. But this was not the case. It took so many CSOs, having meetings and having discussions to say GBV response should be, an essential service. Until date, I haven't seen like a national circular that says, this kind of services are primary services for women and girls to benefit from. And because of the restriction of movement, it makes the work of we service providers a little bit more harder, because you have women who are stuck, in their homes with their abusers, and they cannot move around. And even we, I will speak specifically for my organization, for example, we don't have passes, to move around, to move survivors. We don't have vehicles to move them, to shelters. And we don't even have enough shelters that can take these women. And one thing I've seen is that we do not have like a very great referral system going on right now. We don't have a lot of collaborations going on. And, for example, Lagos State has, tried, honestly, in terms of getting collaborations. But I don't like to use Lagos State as my reference points, because Lagos State seems to be a bit more advanced. What about other states that don't have a domestic and sexual violence response team? What is the coalition or the coordination like in those states? If we are providing mental health services, where do we refer victims to for shelter, or survivors to for shelter? What medical facilities can they go to, to receive, support or to receive medical help? There is a dearth or a lack of, proper referral system going on right now. And the lockdown makes it more difficult, because we have people who would say, I want to report a case to the police, but how many police stations, are currently responding to SGBV cases? I've even heard that some primary care centers actually are just focusing on COVID-19. Some hospitals as well are focused on COVID-19, but GBV services, medical support services are not being focused on. And so there is a gap in that area. I also want to talk about, lack of communication. Right now, we're experiencing one of the greatest pandemics that the world has experienced. And CSOs are doing all that they can in terms of providing information and all of those, but it's not getting to the grassroots. How many people in the grassroots know that there is an existing support system for them should they experience domestic or sexual violence? There is no communication. I've tried my best to listen to major radio stations in Lagos. I haven't heard, jingles or information in local dialect to enlighten people about, GBV cases right now and where they can get help from. There is absolutely nothing going on. And I think the Federal Ministry of Women Affairs and even the state ministries have to do much better. I mean, I've looked up on social media. I haven't seen any communique from these ministries. I haven't seen any, information about GBV response or even prevention from these ministries. And so there is a big issue in that regard. I also want to talk about the limitations on jurisdiction. So we know that, some CSOs or some organizations have key focus area. And there was a recent case, I will use a recent case as an example. A recent case was referred to a government institution, and it had to do with, a boss who was molesting his employee, who was stabbing his employee and all of these things. And the feedback I got was, oh, this is not what we're supposed to do because it's not a marriage. Can we begin to break down what domestic violence really is to capture intimate partner violence as well as every other issue? Because what is happening is most organizations are rejecting cases. And to be honest, maybe to no fault of theirs, maybe, people are shutting down, there's no capacity, but there's so much government should be doing at this point. CSOs can only support. And I think we get to mistake the role of CSO in terms of providing support. Our job is not to replace government. Our job is to support government, which means there must be existing structures in place that government is doing or that is implementing, and we as CSOs are only providing support in that regard. If you look at other countries, government is providing shelter. We have a Women Development Center in Abuja. I would have expected that that would have been turned into a shelter, knowing fully well with forecast that there is going to be, an increase in the number of cases. Rather, this was turned into, a COVID-19 isolation center. I'm not saying that's not great. That's great. But that's a women development center that is, that is for women. And I would expect that women's issues will be priority. We would think about creating, better support services. Do we want to, have like a place there where women who need, sanitary items, there is like a hotline that they can call and it will be delivered to them. I mean, we need to creatively, provide support right now to women. GBV cases are on the rise. We don't have enough structures in place to attend to these cases. I have had to collaborate with the Dorothy Njemaze Foundation in Abuja on certain cases because we don't have shelters. And when they take them, to NAPTIP is also refusing cases now because they say, oh, they are up to capacity. So where do these women turn to? Where do they go to? So we need to actually look at, gender approach in any situation. It can't just be, COVID-19 alone. Even post-COVID-19, there is a death, of shelter. That's a given. We can't hide. We can't even fake it. There is a death of shelters. And I'm not just, as part of my recommendation now, perhaps it's time to think, outside the box, right? Perhaps it's time, like Lagos State, is trying to adopt now. Maybe it's time for the abusers themselves to be the ones to lose their homes, not victims being moved around. When a person is accused of murder, society is not moved out of society to accommodate the man or the murderer. The murderer is removed from that society and put either in a cell or in a correctional facility, pending when they get convicted or when the judgment happens. How about we begin to look into different approach? The abusers themselves losing their comfort. We can't keep moving women around. A mother of 4 who is pregnant, who doesn't have formal employment, what shelter is going to take her for 6 months? Even if there's a shelter to take her for 3 months, we have to look at the economic aspect of this as well. Where do they get money to fend for themselves? The 4 children, who takes care of them? How can women get back on the feet? These are things we need to start looking at. Maybe we should change our approach going forward. Another recommendation I'd like to give is to create an updated GBV referral pathway. Lagos is doing great. Ogun State is doing great. Abuja is doing great. These are not the only states in Nigeria. Nigeria has 36 states. What about, Imo State, for example? What about Katsina State? What is the referral pathway in those states? We need to have like an updated referral pathway. So if Stand to End Up Initiative is providing counseling support, Member Center will provide medical, another NGO will provide legal. Let that be a very strong referral pathway. So it makes our jobs as CSOs and even for the clients, it makes it easier for them to report cases. So for example, if I want to get a medical case, I don't have to come to STAIR. I go directly to Member Center because the pathway is very clear. Right now, we don't have such. And I think we need to create that. Additionally, now that the lockdown has been eased, there are concerns that there are possibilities that this may, lockdown may occur again. CSOs need passes to go through and also support in terms of moving clients, pending when we can readjust our system to ensure that the person who loses their protection and their home, is the abuser, not the client. Pending when that happens, we need support in moving, our clients around. There has to be a very strong sort of support from government. And I keep saying government because, again, CSOs can only support. It's not their role to take over government's responsibility. And in terms of COVID-19 bringing families together, maybe it's bringing them together, but it's also creating, a space for more women to experience abuse. There are young girls right now in grassroots areas who are susceptible or vulnerable to being abused because they can't afford sanitary pads. What is government doing about it? I mean, COVID-19 right now is the priority. Yes, there are funds that have been budgeted for different issues, but right now we have a global issue. Our priority must be what are the issues women and girls are facing during the pandemic, and what can government do to ease the burden both on the client and on the CSOs? Because if I'm having 80 cases in a month and I don't have a shelter to put them, what am I supposed to do? I'm failing them. I'm leaving them in the abusive environment. Most courts are closed. Yes, courts are now adopting an online, trial method, which is really good. But women in the grassroots, for example, how many of them have information to access services? But we have local government, we have NOA. We can speak to NOA to support with, creating awareness in those different states and local governments. So I'm going to end my conversation here, but I think it's important that we have like a proper and holistic response system and prevention. We can go to radio stations with our passes to create awareness in local dialect. For NGOs or CSOs in communities, for NOA in communities, we can go to communities to have conversations around GBV, and prevention. All of these things we need to do. We can't just keep saying that, COVID-19 is a problem. Yes, it is a problem, but what are we doing to protect women and girls? And for those who experience abuse, how are we protecting them? Thank you.
Thank you so much, Ayodeji. Thank you so much for bringing passion to this conversation. We completely agree with the points you raised. Everyone, I just want to apologize for what just happened. We had a hacker that hacked into the room. We just want to say we are sorry. We've been able to remove the hacker. Apologies to all that have been offended by the comments of the hacker. I will now hand over to Vivian, who is going to take the session on question and answer session. Vivian, you have the floor. 15 minutes.
Thank you very much, Nkechi. We have 15 minutes for this session. I would want to say thank you again to all the speakers who have spoke passionately. Now, these questions are coming from the chat room and some questions that were sent ahead during registration. We have 2 questions each. We just have 6 questions for now before we go into the interactive session. And each speaker will have 2 questions to respond to. I'm going to just quickly start with Ayodeji. She spoke last. You spoke passionately about the issues of sexual gender-based violence and the need to turn the situation around, especially when it has to do with the perpetrators. There's a question here for you, and I would like to find out if there is a platform in Nigeria for men. Is there any platform whatsoever in Nigeria that engages men on sexual gender-based violence, on sexual health and reproductive rights, as well as other harmful practices that are perpetrated against women? Does such exist? Someone would like to know.
Thank you very much for that very important question. So yes, there are CSOs and movements that engage men to teach, positive masculinity, gender equality. There is the Young Men Against GBV Network. There are several CSOs. Stand 200, for example, we go into communities to engage boys and men, teaching them about gender roles and gender equality and practices, attitudes, and knowledge that contribute to gender-based violence. But we can definitely do more. And I kept mentioning NOA because NOA is National Orientation Agency, which means they have a mandate to create awareness and behavioral change communication around several issues, including GBV. So we have that network or that platform that has a representative in every local government. So imagine that we create like a communique or like a campaign that they go into the communities to create awareness about, would reach more people. But if a CSO in Lagos is only working in maybe Ajegunle, one in Kaduna is only working in Zaria, I mean, we are not reaching the entire Nigeria, and it takes a lot for us to achieve, behavioral change. So there are CSOs actually doing this work, but we need to do it on a national level at this point. I think your microphone is on mute. If you can hear me, your microphone is on mute.
Oh, true. Sorry about that. So yeah, I agree with you on what you said. We need wider coverage of such initiatives to engage with more men. Now, a lot of questions have come in for the Honorable Minister, okay? And a lot of them have to do with concerns regarding post-COVID. People would like to know what are the plans you would put in place post-COVID. But first and foremost, here's a question for you. Someone would like to know how you are coordinating the efforts of all the 36 ministries of women affairs across all the states. Is there a coordination platform, especially as it regards prevention and response to the COVID-19 pandemic, and as it affects women? Is it trickling down to communities, or is it just at the national level? People are complaining that they are not receiving palliatives in certain states, they are seeing it in certain states. So is there a coordinated platform or effort to this response across all states?
Thank you very much, Vivian, for that question. Before I answer your question, maybe I will throw a little bit of a light on what Oluwaseun said. I need to throw some light on most of her concerns. I sincerely appreciate her passion and her concerns on issues affecting women, particularly the gender-based violence and then the sexual abuse women and young girls face during this COVID-19. The ministry is doing quite a lot, and we are well coordinated with the 36 states, including FCT. We are online with all the states' ministries of women affairs, and we ensure that they also reach out to the local government and ward level. So it's not just about us doing our bit at the national level. As regards the gender-based violence, since even before COVID-19, we've been closely working with the police, monitoring what has been happening in the various states. And I will tell you, since post-COVID-19, myself and all my staff, the permanent secretary and all the directors, sometimes I will call them midnight to give them reports of what I see on online or any information I get from any state. I give you an example of a woman that was abused in Osun. I was very impressed with the immediate reaction of the police because they know we are closely monitoring. I was highly impressed. The police commissioner in Osun and the inspector general of police took prompt action, and the police officer that abused that woman has lost his job. I immediately reached out to the commissioner of police in Osun. I commended his effort and encouraged him. Immediately, I called the inspector general of police that same day and commended his prompt action. That gave them encouragement. Few days before then, a female commissioner of police was named in Abia State. I quickly reached out to her, encouraged her, and asked her to be the eyes and ears of women, because we don't have many of them occupying such positions. And I told her, I charged her that the ministry expects more from her, not just the ministry, but the whole Nigerian women, because a lot of women are being abused, a lot of women are dying in silence, and when they are caught, when the abusers are caught, sometimes they are left to go scot-free. But I want to say that government is doing everything humanly possible. Mr. President is very committed on this issue, and he has made it very clear, and he has given his support on the sex offenders register that has been opened all across the 36 states. You remember last year when the sex offenders register was officially opened on the 25th of November during the 16 days activism. Mr. President has been very, very concerned about issues of gender-based violence and sexual abuse of women and children, particularly minors. For as regards enlightenment and awareness, since COVID-19 stepped in, my ministry, we've done jingles, we've in different languages. The ministry has done radio and TV jingles in different languages. The 3 major languages, Igbo, Yoruba, Hausa, even Fulfulde, then Pidgin, English, and Pidgin language. And we send these things across our platform to all the 36 commissioners of Women Affairs. Last week, we had a Zoom meeting with all the commissioners in the 36 states, and I charged them to make sure that they should produce these jingles, they should digest it into their local dialects. And I know many states have done that. Akwa Ibom has done that. Enugu has done that. Across all the states, they have done that in their local dialects to make sure we reach the unreached at the grassroots. So Olu was saying, if you want to confirm this, please get in touch with me, or even Nkechi can give you my number, and we will send you all the jingles and the jingles we have on COVID-19 and the ones on gender-based violence.
Thank you very much.
Fully answered?
Yes, you have made an interesting attempt to answer the questions, and I'm sure some people should be comfortable with that for now. I have a question now for Ebere Ifendu, ma'am. You talked about from the angle of women leadership. And so there's a question here for you as a female leader and for other female leaders that you work with. What practical steps have been taken now and will be taken post-COVID-19 to achieve gender equality that we are all speaking about? They want practical steps now. People want to know what has been done, what is being done, and what will be done post-COVID, coming from the angle of you as a leader in Women in Politics and the Civil Society Forum. You need to unmute your mic, ma'am. You need to unmute your mic, ma'am.
Your mic.
Thank you.
From them, actually, not from me, from the, okay, so thanks for that question. And for us, we started the work early, like we always want to start before, the election cycle. So luckily, we are one of the organizations Madam Ene talked about that is working with Action Aid under the WVLN program. So this time, I think we have a good support to start early to begin to talk about, women issues in leadership. We started a radio program on the constitution we want, because coming to think of it, if we don't have legislation, it's going to be another problem for us in getting more women into governance. So we started the radio program, The Constitution We Want, looking at all the sections of the Constitution we think should be amended to, make it more possible for women to participate. The radio program is still ongoing. And we also have received, moving away from this one to talk about what the minister said, we've also have received a copy of their jingles, and we have also given to the radio presenters to make sure they, include it while we are having the constitution we want. So with the support of Action Aid coming up this time early enough, because we have noticed that we need legislation. We have reached out to political parties. We have signed an agreement with political parties that come 2023, that we're going to have 30% of women as candidates from all the registered political parties. We have done a lot of advocacy on that area. And then we've also started the Political Academy for Young Women. Because we need to have these young women properly trained and then put into political parties of their choice, guide them to understand the intrigues of politics and then how to become candidates of their respective parties. So this we have already started. We are working to ensure that by 2022, we already will have our candidates. And then we'll know that what is left for us to do is to have, is to give them the visibility they want and they need actually. Because if you don't, bring in these younger women now, giving them the proper training and ensuring that they belong to political parties, because our major problem as a party person, as a politician, as a leader, I have seen that most times women come into the race very late. They just come into the race at the point that they are, going to pick candidates. And then if you follow party politics in Nigeria, they are not ready to just, create that space for you that's just coming to join the political party. So what we have done now is to ensure that our women become card-carrying members of political parties, and then also be part of activities within the party. We have started with some states who already started conducting their local government elections. And we have a success story. We work closely with the Ministry of Women Affairs. And then at a point, we have some issues where we can't handle. We bring in the Honorable Minister to use her political influence to get tickets for some of these women. And that we have really achieved. In some states, I think, I remember a woman calling from Ondo State with issues on that. And then with the support of the Honorable Minister, she got her ticket to run as the chairman of her local government. So you see that the pressure is there to government to ensure that women, get a space in the whole thing. But majorly, if we do not come together as women to ensure that we have affirmative action in the Constitution, the amendment of the Electoral Act, it's going to remain a problem for us, because all we need to do will now remain to just plead and advocate. And in most situations, when they don't listen to us, you won't have any concrete grounds to even fight your cause, because there's no justification or legal status for you to fight on. So I think that we are doing our best as individual organizations. We are doing our best as women collectively, but we need to put more pressure and work closely with the National Assembly. That we have done. And then again, on some of these issues, we are already in court with the Nigerian government. Barrister Esther Ozoma is already in court on behalf of women in politics and other women groups on this issue, because we think that it's not just about coming out to begin to just talk about creating spaces for us. We need to show that we understand what we are asking for, and then that is also within the Constitution and our right to get those things achieved. So for me, I think starting early and then getting some of these things in place will give us a more, prominence in 2023. So let's also ask that our women that are not in politics should join politics, be card-carrying members of political parties, and then participate. That will help. Thank you.
Thank you very much, Ebere. Key word or key phrase is start early. Be prepared. In all spheres of government, non-governmental politics, it's important that we start early, put on strategies and systems and structures in place to ensure that we prevent and respond to issues such as GBV and the hardship women tend to go through in pandemics such as the one we are experiencing right now. So quickly, because we want to save time, I would just share one more question, and that question is for the Honorable Minister. People would like to know, ma'am, based on your learnings from this pandemic, how it has affected women in all spheres of life, especially those with low income. What will the ministry put in place to ensure that they address such situations in future? So we are looking at a post-COVID-19 response. Based on everything that we have experienced, the ministry has learned, information you've gathered, data you have collated. Do you have plans for the welfare and well-being of Nigerian women post-COVID-19? We would like to know that, ma'am.
Thank you very much, Vivian, for that question. Very well, we have plans. And again, to show the commitment of Mr. President on issues concerning women, Mr. President has put in place a National Council on Skills chaired by the Vice President And this is to take care of women and youths. So my humble self, the Minister of Youth and Sports Development, are members of this committee. We also have ministries that collaborate with us in ensuring that they train the women and youths to ensure that they are trained and empowered in preparation. That's the post-COVID plans for women and youths. We have the Ministry of Trade and Investment. We have the Ministry of Labor and Employment. We have the Ministry of Communication and Digital Economy. All of us are members of this committee chaired by the Vice President. And this is to take care of post-COVID-19 because it is clear that women are the worst hit. And if plans are not put in place to ensure that these women are supported and encouraged in the various skills and empowered, we will face more problems. So this is already in place, and the committee is working around the clock to ensure that certain things are put in place, funds are made available, the training of these women and youths are put in place to ensure that they are empowered. Also, currently, my ministry and the UN Women are also working together to collect information on state level intervention to response to COVID-19 pandemic. The mapping is expected to serve to strengthen our efforts to ensure that gender responsiveness of all federal and state interventions carry all women along, particularly our young girls. We are committed to this, and we are working to ensure that women are not left behind or remain vulnerable as a result of the challenges of post-COVID-19. I forgot to clear an issue also on the question that Olu Seun had asked about shelters. Yes, we have shelter in Abuja, but you know that for security reasons, we're not supposed to disclose it publicly where this is, but we are closely monitoring with the security agents, and we have quite a number of women in our shelter. We monitor, we pick them when we get the distress calls, and we make sure that they are very comfortable. If you want to see the shelter and know what we are doing there, you are free to meet us in the ministry and we'll take you there. That is for Abuja. For the 36 states, we are reaching out. Some states have. Lagos are doing well, Ekiti are doing well. So many states in the Southwest and Southeast and the North. And I'm reaching out to other states that don't have safe homes for women, particularly since COVID-19 stepped in. I have been on phone to reach out and appeal to wives of governors, commissioners, and our governors to make sure that a safe home is created even within the state and local government level where women can run there and have a safe refuge. So we are not mindful of this, and we are not resting on our oars because we cannot fold our arms and allow women being abused and thrown on the streets. We have safe homes, but it is strictly on security grounds that I cannot disclose the venue where it is located because it will not be safe for the victims that are there. So we normally keep that as very strict and confidential. We are also working with other stakeholders to create safe homes for women nationwide. So the shelter issue is top on my agenda. I'm very concerned, and we are working on that. We are encouraging states to have that. For us here in Abuja, we have, and more will be created in other states that they don't have. Thank you.
Thank you very much, Honorable Minister. It's good to know that, shelters are top on your list. We are looking forward to a time where we have them across all states of in the Federation, and they are active and functional and actually catering to the needs of survivors that need to be there at that time. For sharing with us that there are plans in place for post-COVID interventions for women. As that strategy is being developed, we would like for wider participation, amongst all stakeholders, beyond just the different parastatals and MDAs, but as other women groups, CSOs, community-based organizations, representation across all board, so that the needs of everybody is captured. That would be most amazing. Thank you very much, Mafe. Thank you, Oluwaseun. There is more coming up, so please be geared up. Now we are going for live questions, and that will be the interactive session that Nkechi will be hosting. Back to you, Nkechi.
Thank you, Vivian. And thanks our panelists for doing justice to the questions. We now want to go to interactive session. We have a couple of hands we're seeing here. So you has 1 minute, please, to speak. 1 minute, so that we could get as many people as possible to be able to interact. Keep it to 1 minute. Buki Shonibare. Buki?
I'm muted. Can you hear me now?
Yes, yes, we can.
Okay, thank you very much. And thanks for all the interventions and the lessons learned. I have 1 minute. So just 2 things I want to say. I think that there has been a lot of conversations, a lot of webinars around GBV issues, especially during this pandemic. And I think a lot of lessons has been learned. I want to propose that, a key fallout of this webinar or of this conversation can be 2 things. First, the Honorable Minister's Office, working with CSOs, might consider the possibility of documenting our stories, our processes, our lessons. And we should start it now, not after the pandemic. From a gender perspective, how have we responded from a gender perspective to this pandemic? That way, we would be able to juxtapose the gaps against our key objective. And I think that our key objective is that the needs of women and girls are prioritized during this pandemic. And the essence of that also is to help us, plan ahead and see what sort of structures we must put in place. The second thing is that the reporting, response, and referral pathway that Sheung mentioned earlier, I think it's something that we might want to work on, just so that, as women, CSOs, and even a ministry that is focused on women, we can have key outputs. If we can, together with government and CSOs, work together on a reporting, response, and referral pathway for each of the states, because the peculiarity for each state is different. Something around medical, legal, counseling, shelter. What is that referral pathway? What's that reporting pathway? What's that response pathway? I think with that pathway, we can communicate better how people can get help, both during the pandemic and outside the pandemic. Thank you.
Okay, thank you, Buki, for that. I'll call the next person, Blessing Duru. Blessing Duru.
Hear me?
Yes, please, go ahead.
Thank you, my sisters, for this opportunity. I just have 2 things to say. The first one has to do with the responsibility of the Federal Ministry of Women Affairs in terms of coordinating the 36 state ministries of gender and vulnerable groups. I think they need to do more. Speaking from experience, when you meet most of the commissioners of state ministries in the southeastern part of this country, they are lost in terms of what is happening at the national level. I heard her when she said they've passed some of their jingles to states, but I reside in Imo State and I have never heard your jingle. So I think there's a disconnection and you need to look into that. Then secondly is for my sister, Auntie Ebere. I think you're starting well in terms of mobilizing women for 2023. But I also feel that we need to begin to look at how do we get women at the community to be part of this process. Most of what we are discussing here is all about the national. If I'm looking at it at that level, a lot of focus is at the national level. So we need to begin to look at strategies, how we can get people at the local government, just like Shehu said. If we can get NOA involved in some of the strategies that we put in place, it will go a long way in helping us to reach the poorest woman in the different communities that we have in Nigeria. They have that structure already, so we don't need to reinvent the wheel and begin to think of, okay, what do? We already have them. And now is to see how to use them in implementing some of these wonderful ideas that is coming out of this webinar. How do we get them to be part of the process? And I think when we do that, we'll be able to reach more women than we can imagine. Thank you.
Thank you, Blessing. We now have Rhoda. Rhoda Toyden, please speak. 1 minute. Thank you.
Thank you, Nkechi and Action Aid Nigeria. And I want to say hello to my auntie, the Minister, Women Affairs. You're doing well. Pray for God's guidance. Mine is something that I need to share with CSOs here. It is recognized and documented that majority of domestic violence is perpetrated by men against women. That has been acknowledged, and it is a known fact. But in our work in FIDA, when we have cases, the normal thing is to allow the principle of fair hearing to come to play. And I can tell you that during this COVID-19 intervention, what we've been doing, I have had 3 men who complain. And when you hear and you listen to their stories, you know that they also have something to say. So I think CSOs, for us to achieve gender equality, we should start looking at support system for men victims. There are some of the women that when they complain to you, and even you see the need for them to leave those homes because they are no longer safe, but they will tell you they will not leave. You are not saying they should leave, but from their body language, you know that they don't want to leave. So what should we do to ensure that homes are safe for both men and women? I think there are so many men out there that need psychosocial therapists. So some of us in CSO work, we should begin to look at making an effort to ensure that men are carried along, because there are men that are really crying. But you know, traditionally, culturally, when a man speaks out to say that he is being victimized or he's being violated by a woman, it is a no area in our tradition and culture. But I think we are clamoring for gender equality. We should start looking at that possibility. And I say this.
Barrister Rhoda, will have to stop you. I'm sorry. Now, so that others could be able to speak. So we'd like Uchenna Nwokedi, please keep it brief so that as many people can also speak. Thank you.
Okay, good evening, everyone. Thank you, Action Aid, and good evening, Honorable Minister. Nice to see you here. We've said so much about gender and COVID-19. What I would also want to start, what I want to see the ministry begin to do is also to focus a bit on children and how this COVID-19 affects children and the role of violence against children during this period. You know, we talk about Child Justice Administration. We see children going through the adult prison, and one begins to wonder, is there anything that the ministry can do to ensure that these children do not end up in adult prison. Rather they go to remand home or children's correction center. I just want to know, is there anything that the ministry is looking to do post-COVID-19 response on how children would stop ending up in adult prison? I know that the ministry, one of the mandates of the ministry is to implement the provisions of the Child Rights Act. And one of the provisions is on Child Justice Administration. Children shouldn't go to adult prison. There is a need for family court. So perhaps what we may need to do is to see how the ministry can please, do advocacy to the Chief Justice and also to the FCT Minister to see how we can put the Children's Correction Center in Guako in use, and how also the Chief Judge can support to designate other family courts. Right now, FCT has just one family court in principle. They will tell you they have two, but only one is actually working. I want to, appeal to the Honorable Minister to please include this in one of the things she would do during COVID-19. And Honorable Minister, it might also interest you to know, and I'm sure
you have, 1 minute is up. I'm sorry, we have others can really.
Okay, yeah, thank you.
Yeah. This is exactly 4 o'clock and we promise to end by 4. I would like to indulge crave your indulgence that you give us additional 5 minutes to be able to wrap on things. I will just allow one more person to speak. Olayinke Timper, please speak. Seconds,
good afternoon. Can you hear me?
Yes.
Good afternoon.
Good afternoon, Olayinka.
Okay, my name is Olanike Timipawige, and I would like to talk also from this perspective of girls. We all know girls are more vulnerable to gender-based violence. So beyond the jingle, I would like to suggest that the Ministry of Health look into partnering with the Ministry of Education to leverage on the homeschooling platform to provide a comprehensive sexuality education for girls. Because studies have shown that girls who have adequate knowledge about their sexual and reproductive health rights are less vulnerable to gender-based violence. Thank you.
Thank you very much, Olanike.
Thank you. So do I have the grace for additional 5 minutes? Can we go for additional 5 minutes, please? Do I have a yes?
Yes, you can.
Okay, to the panelists. Okay, so I will allow 2 more persons. Vicky? Vicky, please speak. Vicky, could you please talk?
Good evening.
Good evening.
Thank you for the privilege. First of all, I want to send my regards to everyone here. I want to say something. I want to thank the Honorable Minister, Madam Ebere. I've got an opportunity to meet her on one occasion. And I could say for sure that she's very passionate about the rising of women in politics. Well, everybody calling in here is more focusing on the minister. I feel like we all have a lot to do as women, as young girls. I am 19 years old. I advocate for youth awareness because there's a lot those women are doing on the national level, on the state level. They are giving out value. If we as youths, younger girls, are having misplaced priorities, then whatever work or whatever effort they are putting in is just waste. We talk about segregation of women, people not having palliatives. Having a pandemic like this, we're not expecting women to be beggars or expecting women to be more vulnerable. If 2 years ago, 5 years ago, more women were putting effort into establishing themselves, doing more things for themselves, surely the burden on the national level will lessen a bit. Women are meant to be nurturers. Women are meant to be organizers. Women are meant to be heads. Women have the opportunity to do more than 10 things in a time. No woman is a liability. So what I'm trying to say here is, we as women, younger women, I expect that there will be more youths, more younger women in this life today. All that I'm just trying to respect. I don't know if that worked or it was possible, but there's a lot we have to do. If you go on Twitter right now, we are having a Zoom live and we are all talking. But go on Twitter right now, you will see young women, young girls who have lost themselves. They feel they don't have anything to offer. They go online being nude, doing all manner of things. And are these the same women we want to contest or want to prepare for politics in 2023?
Vicky, you need to keep it short and simple.
Thank you. I'm sorry. I'm sorry. What I'm saying is that there's a need for younger women to be more aware of their potentials and what they are going to give to us, to society, in years to come. Thank you.
All right, thank you so much. We have Zainab. Zainab. Oops.
Yes, thank you for this opportunity to have this discussion. I actually want to talk more about the women in the communities. Like the NGO I work with, we work mostly with the community women in the rural areas, and it will make a lot of sense. It will make a lot of, it will help these women, especially in the communities, to know what is actually happening, because the women are lost. We are always in touch with them to find out what is actually happening in the community, but they are lost. So I think we should gear up more. The Honorable Minister, we should liaise more with these CSO and NGOs that work in the communities to see actually how we can step down these messages to the rural women. And also the rural women, most of them will lose their livelihood. Most of them are peasant farmers, and they cannot even sell what they have to sustain themselves. So we should come out with innovative ways to help these women, because post-COVID-19, so many of them had lost their savings. So we should be up and doing to see how we can do to help these women, kind of regain back their lives. Thank you.
Thank you. And finally, I'm going to call
Thank you.
Yeah, I'm going to call Mary J. Mary J, please, if you're on, can you raise your hand and then wrap it up as a young person and a member of National Coordinator of Activista Nigeria. Mary Jacobs? Okay. If Mary Jacob is not speaking, I'll come back to the panelists. First, I would like to ask NOB to make a comment, and then we'll give the other panelists one minute to be able to wrap up their own points.
Okay, thank you very much. I want to say a big thank you to all members of the panelists. Maybe you give me a little, maybe 1 more minute, to explain certain things because of what happened. Maybe the hacker is not an accident. I know it was an attack on myself and Oluwaseun. It may not be an accident, but a sound reminder of what women politicians will go through. It's a sound reminder. I am sure that if we ask the Honorable Minister what she faced through in her elections and all of that, the volume of what women will tell you is another thing.
Yeah.
So I am so happy to be a woman. And of course, whatever it is, I'm a married woman, I have children, I feel great to be a woman and have no regrets. We have had things done to women politicians. And this is a reminder of the strategy we need to put in place with the Berry and all others, those who are going into politics. They will look at you and call you a prostitute. That's the other name for a woman. It's not something to make you angry. Don't be angry, because you already have the prize. You are a presence of the Almighty. So what I'm happy that somebody got so pissed off and started multiplying things about, going to bed with somebody and things like that. Yes, men go to bed with women. So what? It's a good reminder to each and every one of us of what can happen. So as we prepare to engage and take women and make women go more into politics, let's be ready for what will happen. A reminder of what happened to a lady who was really going into politics, who has registered and was going for elections, and they made the son to make love to her many years ago. That is still a reminder to us about what they did with that woman. to stop her from politics. So if we are advocating, and I want to ask Ebere, we are more than 50% of the population. Why is women in politics asking for 30%? 30% is behind Beijing, which was 25 years ago. So I'm so happy that they brought it, because we would have had this webinar without talking of this solid area. So I'm happy for the for that person. To note again that National Women, Center, that's the Women's Center, it's been made a COVID-19, isolation center. It's really a shame for Nigeria. The National Hospital was meant for women and children, and the politicians made it, and now it has become a national hospital for how many years down the line? After democracy, the hospital built by the military, Nigeria has not been able to build even hospital in Abuja that can respond to the population of Abuja. What a big shame. And now the National Women's Center, is being taken. I want to say that we have a ministry that is ready to work with women. So we are honored that one of our very own, Auntie Pauline, is here and she's ready to work. I want to pledge the support of ActionAid and many organizations that now we have a special opportunity to bring together more than 100 CBOs. Now we have even further funding for more states, and that means more organizations to bring women around you. One of the things that I will ask Nkechi and your team to do is for you to have a list of where we are working, especially at the state level. We have some projects at the national level, but we also have state level, activities that will be able to direct us, so that if there is anything we need to amplify, if we need to work with the commissioners of women affairs, we need to work with them. And Rhoda has brought a point that in gender, when you say gender, gender has to do with both sex, male and female. When we're able to note even one issue about a male, it will make us to score, a lot of mileage. So we need, a lot of things that we're going to do. I'm really pleased about this webinar this afternoon, and I hope that we'll engage with more people to learn lessons from the politicians, what they did, what they saw, how can we prepare ourselves for ahead. So the hacker, instead of making something in the negative, has done something positive, and we must be thinking and putting strategies together. So I want to say big well done to each and every one of you, and the sky is the limit. We are ready to engage. Thank you so much. Sorry that
Thank you. Thank you, Anna. Thank you, and I think we need it and it came at the right time. So I'm going to give just 1 second to Mary Jacobs. It's important that we hear her voice. Mary Jacobs is the National Coordinator for Young Persons Movement. So we also need to hear their voice as well. So please, Mary Jacobs, you just have 1 second if there is anything like that. Mary Jacobs, please go ahead.
Thank you very much. I would run. Good afternoon, good evening. This is a great opportunity, and I'm excited that we have this. For me, feels like an intergenerational gathering.
Okay, Mary, it seems you have a poor network. We could just go straight on to the speakers. Apologies, everyone. Please, Ebere, can you please, Ebere, can you please take the floor?
Hello? Hello. Sorry, I think I went off a bit. So I was thanking Momiene for bringing that up. I was going to mention that. So I don't think that things like that are coincidences. So these are things that we as women, even as young women, even without being in the political space, these are things we face. So if we decide to ignore and avoid the fact that patriarchy is existing in our society, then woe to us. These things are going to come. This thing actually came to disrupt us. Then I'm going to rush a bit to the minister. This period is a very trying period for us. It's a trying period for the world and for women and girls. And I'm going to talk from the young people's perspective. This is a very crazy period, and most times it is very difficult for young girls to actually reach out and I'm very excited that Ayo touched a bit of it. So I'm going to make a personal request for young girls out here. So I'm going to ask if the Honorable Minister can find it possible to help us put up a toll-free line, a national toll-free line that wouldn't cost and would be easy for us to actually report issues. So we could just press a button and then we get the kind of energy, the kind of help that we need, that we decide, that we deserve. This period, young people, girls, women. Okay, yeah, I think my time's up. So thank you very much.
Thank you, Mary Jacobs. Thank you. Ebere, please, you have the floor.
Okay, thank you, Action Aid. Thank you for bringing us together to discuss COVID-19 and our role as women. Taking the question from what Madam Ene asked, why are we asking for 30%? I've always been an advocate of parity. I've always talked about 50-50. But if we are saying we want affirmative action, into the Constitution, and we bring in parity, that will, create a kind of confusion if the affirmative action is talking about 35%. So, but for me, the matter that is already in court that I said, I talked about earlier, that Esther Zoma, barrister, is already in court. She's talking about parity. And so our target actually is 50-50 for Nigerian women. And it's a good opportunity for us to come together, with other organizations under the WVLN program. And I think by 2023, some of these issues we are facing now will not face them any longer. And my key parting word is for Nigerian women to know that the road to politics is a very rough road. Very rough road. So it's not going to be a tea party. And I'm happy that Nigerian women are very resilient. We are ready to go through that. I like the way Madam Ene turned, what the hacker tried, to use against us into a positive thing. We are used to it. I mean, when they don't call us those names, I begin to wonder, where are the men? Are they okay? And so we are used to it. And then we are going to walk along with it and, get to our destination. Thank you, Honorable Minister. You're a wonderful woman. At every point you're called upon on women issues, you're always available. You always create time. I mean, I don't know how you do it, but the Lord is your strength. And like I always say, this is our ministry. This is the time for us to get it right. And if we cannot get it right with Madam Pauline as the Minister of Women Affairs, I tell you that we are doomed in this country. And so let's give her all the support necessary to make sure that Nigerian women, are placed in their rightful positions. Thank you, everyone, for coming on board. Thank you.
Thank you, Ebere. Can we have Ayodeji, your closing statement?
Thank you very much, Action Aid, for having me on board, and thanks to the panelists. And I want to appreciate the minister for providing some context to the issues that I raised. In closing, I want to take from what Buki Shonibare had said in terms of the way forward. What are the next steps? It's okay for us to identify the problems and make suggestions or recommendations, but what practical steps are we going to take, even during COVID and post-COVID, to prevent GBV and also respond to it? And one thing I think is very important is a very clear referral pathway, and also collaborating with other agencies, to provide information and support. And, I just want to make reference to the governor of Lagos State. If you realize, he's been on TV talking about COVID cases every day and trying as much as possible to get people to donate their buildings. Maybe it is time for us to look within our circles and, the Ministry of Women Affairs saying, who are those that can, donate buildings to us for shelters, pending when we can reevaluate our system to move abusers out of, the abusive environment. And in terms of, shelters being private, that's very understandable. But we as service providers should have a clear pathway to make referrals to those shelters. Because if we have shelters and they are unknown, I really don't see the use if CSOs do not have information on how to refer people to those shelters. So that has to be clearly mapped out during this period and post-COVID period. But in general, CSOs are always ready to work
with the ministry, and we just want a ministry that functions for all of us. It's not a battle, it's a collaborative effort. We're here to support, and we just want a ministry that would work with us, and that we can also work with to ensure that the issues of women's protection and rights is on the front burner. Thank you.
And to the minister.
Thank you very much, Nkechi Ene, Ebere, Oluwacheun. I wish I can acknowledge all of you. Rhoda, Uchenna, Olanikan, Kemi, Zainab, Mary Jacob, for all your wonderful contributions. I want to assure you that I'm fully committed to work with all of you. I've noted all your comments and your contributions. And for all the questions set down, I don't know whether I'll still have the time. I had noted down to answer each one of them. Buki, you started by requesting for documentation. We're working on that. Between us, our international partners and civil society organizations, on our experiences on COVID-19 and plans for post-COVID-19. Blessing Duro, you mentioned that you've not had any jingles in Imo State. Well, I'm sure this is because you will agree with me that your state has been politically unstable because of the change of your governor, and the new commissioner has just been put in place a few days ago, or about a week. So I'm sure she will key in. Meanwhile, we have sent these jingles on all our national radios, and most of the other states in the Southeast have been playing the Igbo jingles. We have it, and we've been playing it. So the commissioner that has just been named in Imo State will reach out to her to swing into action so that you can hear more of the jingles in Imo State. Concerning issues children is top on my agenda, and the girl child, the education of the girl child. We are working hand in hand with the Ministry of Education to address the issues of children and especially the girl child education. For the first time in the history of my ministry, we had a joint, my ministry was invited because of my commitment to work with the Ministry of Education. The Minister of Education last year invited me, and I was in Rivers State for 3 days attending the National Council on Education, where we discussed issues relating to the girl child education extensively. As request for the toll-free line, we are working on that, and it's a great idea. I want to assure you that we'll ensure that that is put in place. I appreciate all of you, and I thank you for your concerns, for your commitment, and for your reassuring words of working, supporting us and wanting to work with us. And I sincerely appreciate you, Nkechi, the whole of Action Aid, and my leader, Ebere. Thank you for always being there for us. As she rightly said, we are working hard to ensure that we scale up the number of women participation in the national, state, and the struggle continues. We can never give up because we are mothers. We are specially created by God to stand in the gap and do the best we can to make the world a better place for our children. Thank you all, and God bless you for your support and contributions.
Thank you, Honorable Commissioner. Thank you, Paris Ebere Ifendu. Thank you, Hashem Ayodeji. Thank you, NLB. And thank you, participants, for staying with us, even though we have exceeded almost 25 minutes past the time. Thank you so much. We've heard a lot. We've taken a lot of recommendations from all of you. We are going to publish this conversation and share with all of us. For those of you who raised hands and we're not able to take you, we apologize for that. It's due to time exigency. We will harvest the questions and still send it to the different speakers to be able to provide responses to those questions that you've asked and we are not able to answer right away. and hopefully they will get back to us with the answers, and we'll share that online. Please keep a date with us next Thursday, as we're going to have another conversation around COVID-19 and accountability. To all the ActionAid planners, those who were part of the planning process, we say thank you for this process. Thank you, everyone, and do have a great day. Thank you.
Thank you. Bye.
Bye.
Bye. Bye. Thank you so much.
Thank
you.
Thank you so much.
Thank you.
Thank you so much. Thank you, everyone.
Bye, everybody. Bye, and thank you so much.
Bye.